Dental implants. What are dental implants? Most patients ask me, what are their choices in replacing a missing tooth? And my answer to them is a dental implant. One of the biggest advantages to a dental implant is that it replaces the missing tooth. This is done instead of a bridge, which means if there's two teeth adjacent to each other and there's a space where the tooth is missing, the dental implant would go into that space and it would be independent of the other teeth. One of the biggest advantages of that is that the implant, once it's placed and heals in that location, it's usually good for the life of the patient. You must have enough bone in order to do this. But even if you don't, there are procedures where bone can be added. Dental implants are usually done in 2 stages. The first stage involves a surgical procedure where a small titanium body screw that looks like a tooth is placed into the bone. And that's done in the office with local anesthesia most of the time. Once that's completed, it takes approximately for that implant to heal or fuse with the bone for about 3 months. After that time period, the second stage of the restoration is done. This is where the connection or the abutment is placed into the implant which is now inside the bone of the patient. And then the crown is placed on that tooth or implant, and it's permanently placed, and that's how the restoration is completed. Once that's done, then the patient can function normally, eat, brush, floss, and everything is as like it was a natural tooth. Dental implants can also be involved with more than one tooth, where when someone is missing multiple teeth, where you replace that area with multiple implants. This includes where someone has no teeth and they have dentures, but they're looking to stabilize the denture so it doesn't move around. So in that case, you could do where you do a couple of implants where the denture is attached to those implants, or you could not do a denture at all and do enough implants so the patient has what's called a fixed restoration, or a restoration that they don't take out of their mouth.